2 weeks ago, hundreds of you had your health questions answered during WGAL Doctors on Call segment. This week, we're highlighting some of your top concerns.
8 on your side, medical reporter Susan Shapiro joins us now with a look at one of the biggest concerns for both men and women, heart disease.
Heart disease is the #1 killer of men and women in the United States, and often people don't know they're at risk for heart problems. Joining me now is cardiologist Dr. Todd Wood of the Lancaster Heart Group. Thanks so much for being here.
Thank you for having me.
So what puts people most at risk for heart disease?
There are a number of risk factors that actually contribute to your chances of developing heart disease. Most notably, tobacco abuse of any form, diabetes, hypertension, cholesterol, as well as a strong family history.
But some people who may not do all of those other things could still be at risk if they do have that strong family history?
Sometimes, despite not having any of those significant risk factors, you can still develop heart disease and more notably coronary artery disease.
What are some of the best things you can do for heart health?
Obviously, if you have any of those risk factors, adequately treating them, trying to remove especially tobacco abuse from that list, and keeping your diabetes under control will definitely help with this, as well as leading a heart-healthy lifestyle that frequently involves aerobic activities as well as watching your diet.
And you don't have to run a marathon.
You don't have to.
We're looking for exercise.
Exactly. We're looking for a consistent exercise of probably about 30 minutes, 4 times a week or more. And really, you're trying to get your pulse up. So this isn't necessarily about lifting weights. This is about raising your pulse so that your heart's getting the benefit.
Well, I was going to say, why is it important to raise your pulse?
Raising your pulse rate correlates with that whole change in the physiology of how the heart and the blood vessels work. It's what ends up leading to the lower blood pressure as well as lower cholesterol and some of the other risk factors being modified.
Well, thank you very much. Thanks for the tips, and we appreciate you being here.
My pleasure.